Welcome to the Relationship Cycle with Jorge and Nelsa, where we discuss dating and other significant relationships.
Hello.
Welcome, Luz. How are you?
Hi, I'm good, and you?
I'm well. Thank you for joining us here at the Relationship Cycle. And just to kind of introduce you, so Luz Velez, who's a dear friend of mine, is a licensed clinical social worker. And we are very excited to have her on today because we are going to discuss mental health and relationships and how it affects people and everyone involved.
Thank you for the invitation.
Luz, this is Nelsa. I've been so excited since Jorge told us about, we talked about who was going to be our guest. And we've been taking questions from our Facebook friends. And I'm telling you, there are some people out there who are really anxiously going to be awaiting this recording. So thank you so much for lending your expertise and helping us, know how to help our partners and friends and other people that we're in relationship with who may be going through mental health concerns, especially as we get close to the holidays and, people are, just triggered or experiencing things, from their past or even right now presently going through. So this is going to be a really important show, I think.
Luz, so please tell us, how exactly is it that you guys help people, and what is kind of like your general, layout and process as far as going about with doing so with your methods?
Okay, so like you said, I'm a licensed clinical social worker, and what we do is we provide therapy for people who desire some support. Everybody has different methods. I am actually trained in cognitive behavioral therapy, in dialectical behavioral therapy, EMDR, and brain spotting.
Can you tell us a little bit about those, Luz? Because I know, Luz, I'm sorry, I want to make sure I say your name right. But I know I'm familiar with cognitive behavioral, which is like typical talk therapy, right?
Yes.
But what about the others? Because there were several in there that I had not really heard of before.
Yes. So cognitive behavioral therapy, CBT, and DBT for short, those are regular talk therapy, right? It's just different methods to get to the message. Okay. Mm-hmm. And EMDR and brain spotting has taken a different approach, and that's more checking on your feelings, right? The idea comes from the body keeps the score. Okay. Mm-hmm. Yes. So when we are children, or even before, when we're fetuses, our bodies react to our environments. And when we don't process events, we might not remember it, but our bodies do remember.
Mm-hmm. Wow.
And then, so with EMDR and brain spotting, it actually uses the eyes or bilateral stimulation to help the body process it. So it's a lot less talk. It's no longer talk therapy. It's more physical. It's more allowing your body to feel those sensations and let it process.
That is awesome. And the reason I think so is because I think so many people feel like they don't need to go to a therapist because they talk to friends and family. I let things out. I say what I need to say, but I tell clients, I'm a certified Reiki master, Luz, and I tell people your body has memory in itself.
Yes.
And muscle memory, huh?
Yes. Well, not just muscle memory, but cell memory, where the actual cells of the body retain memory just like our brains do. And so a lot of times what we don't remember in our mind, it may be subconscious, but it's in our body. But can you tell me, what does that look like though? Like, what would you do with a person in helping them to physically remove trauma or, ill feelings or whatever?
Mm-hmm. So let me start from the beginning, right? So how I like to explain it to my clients is when you go through different experiences, our brains kind of has a rope. I'm simplifying because I love simplifying stuff.
I like that too.
So I like to think about it like our lifeline is a rope, right? And every time we have an experience that it impacts us in any way, shape, or form, it creates knots, right? So as we go on with our lives, we have little knots in our brains or in our being, right? Little knots, little knots. And then when we get older, we have a situation, and we're no longer using this rope as the end, right? We now are kind of tapping into those knots that we haven't even thought about. So we are no longer addressing, or for example, something happens and people overreact, right? The reason that they overreact is not for what is happening right now, it's for all those little knots that we have in the back of our heads. Does that make sense?
Yes.
I like how you laid that out. That really does kind of literally paint a picture.
Mm-hmm.
Exactly. So as we continue on with experiences and we have those knots get reinforced, reinforced, reinforced. And now we're overreacting, or we're feeling some type of way that doesn't any longer have to do with the now. Now we're more stuck in the past, but we don't realize that, right? So
Right.
when you go to therapy, we try to figure out where those knots are. So for EMDR, we would do like a flow back technique, which will take you to, okay, this is the situation that you have now, right? For example, in the morning, I'm driving and the cars are really annoying me and I am very stressed because of the cars. Okay, when have you felt like that before? Go back and see what other memory that taps into, right? So when you do that, you start realizing like, oh my God, this opened this up, and oh my God, that opened that up, right? And then we try to see which one is your earliest memory, and which one is your the memory that kind of hurts or activates the most, right?
Mm.
And then we work on that. What does it look like? Well, it's about bilateral stimulation. So if you're doing EMDR, you're focusing on the eye movement. So the idea comes from when you go to sleep, right? And you are in REM sleep, your eyes move back and forth really, really fast.
Mm-hmm.
Research shows that when that happens, you kind of are setting all the memories, all the experience kind of in a file. You're kind of processing all that happened during the day, right? So some memories get mixed up, or let's look at it as files, right? Some of those memories are not filed in the right spot. So
Mm-hmm.
when we do the EMDR, which is trying to imitate REM sleep, then we focus on processing the file and putting it in order in our brains. Okay. So when they have done research, they have noticed that when you do that, the part of the brain that kind of taps into that trauma gets ignited and get processed. So now you have new connections in the brain that are appropriate. Does that make sense?
It absolutely does. Yeah.
I like it. Thank you so much, Luz, for that explanation. And that definitely
Mhm.
kind of gives some clarity to the methods that you guys use. Now, I want to go ahead and jump into some of the discussion that we had with some of our listeners on Facebook, and they really, really had some interesting talking points and questions that I want to focus on so that we can kind of get started and kind of get deeper into this. So,
Mhm.
one of the questions that I really want to emphasize is, how do we recognize the signs that a relationship in itself may not be good for our mental health from your perspective as a professional?
Okay. So some signs, good question. Some signs is dissatisfaction. Okay. If you're not feeling, if you're feeling uncomfortable, okay, if it's something that is ongoing that keeps making you uncomfortable, that's something that you need to look into. Okay. Does that make sense?
That
Mm-hmm.
makes perfect sense. Yeah.
Exactly. So when do you know that this is affecting you is when you're at work and you're no longer present at work, when you are no longer present in whatever you're doing in your day-to-day situation because you're more concerned on your relationship. That's when you start realizing this is affecting me. I can no longer be present because I am bothered by the relationship. That's affecting your mental health.
And I feel like a lot of people don't have good communication when it comes to dating and relationships. So they usually withhold or suppress some of these feelings and they bottle it up. And the thing about bottling it up is that you're holding all that stuff in. And then when you do have an argument or a disagreement, people blow up. And sometimes those blow ups don't look so good.
Yes. So that's right. When you're not addressing the problem, you kind of are, creating more knots, creating more knots, creating more knots. And then eventually something that's very little can blow up because it's no longer about what happened. It's about all those little knots that have been created over time.
Mm,
Well, let me
very.
ask this in conjunction with Jorge's question. If that's from your perspective, like how somebody is making you feel, like what are I hate to use red flags, but it's such a commonplace term now. But what are signs that the person you're interested in may have issues that you might not want to yoke yourself with?
So you cut off for a little bit. So can you just repeat the question again, please?
I'm sorry. How can you tell that the person you're interested in may have issues that you don't, you may not really need to be involved with them because of? Like you said, being uncomfortable inside yourself is one sign, but how can I look and see, or what are questions I should ask that would tip me off to the fact that this person they may not be healthy enough to be in a relationship?
So if you're comfortable having a conversation with them and being honest, you could talk about the ACEs. Have you heard of the ACEs?
Mm-hmm.
Adverse childhood experiences. So that's a really good starter on mental health, right? Do you know about your ACEs? Or, can we talk about it a little bit? Because that's going to show you a little bit of how, the experiences that they have, how open they're willing to talk about that. Okay. And also how much support have they gotten, right?
Mm,
Because we all have had negative experience, right? How much did it
absolutely.
affect us? And did we get support? How did you overcome that? Right?
So,
Go ahead.
Luz, I wanted to kind of piggyback off that conversation point that you just touched. What, in your opinion, what is a good approach or what is a good technique or techniques as far as helping a partner overcome trauma or mental health illness situations?
Okay, so to help a partner, you need to get educated. You need to find psycho education, learn about whatever it is that it's going on, and learn about your partner, what they need during that time. For example, so DSM, which is the diagnosis manual that we use, there's over 150 diagnoses. Okay,
Wow.
I bet if I ask a normal person how many can you name, it's probably going to be a handful,
Right.
10, right? But there's 150. So there's a lot of other um, diagnoses that we have no idea about. Those the normal person, the common person doesn't know about. So if the person knows what's going on and they feel comfortable talking about it, start researching. Okay, start researching about whatever it is that your partner has. And then that way you're going to be able to understand what it is that's going on. With that also comes your partner's needs to learn to communicate, or it needs to communicate with you his or her needs. Because let's say two people who have depression, which is the most common, they might need two different things.
Very, very good. I like how you structured that. And, it all, we in this, since we've been doing the podcast, we are big on emphasizing communication, opening lines of communication, obviously. And this sounds like this just kind of ties in where you have to vocally express yourself and also lay out, to your partner what you experience and what you go through so that they can support you better and understand you more.
Yes, exactly. So do your own research, but don't just base everything on your own research, because everybody is a different world. Everybody has different experiences, so everybody's going to react different. So you do have to have a lot of communication.
Another topic that was discussed, when we reached out to our listeners, was how does narcissism impact an individual?
Narcissism, so that's an interesting topic, because when you're in a relationship with a person that has narcissistic traits, it's like slowly boiling water. It's
Ooh.
not, you don't jump into a boiling water. It's something that it slowly, the heat slowly rises. Okay.
Wow.
So when you find yourself that it's boiling now, right? It has damaged, it has caused a lot of damage. For example, isolation, right? Self-esteem, um, the ability to make decisions because your self-esteem is so low. Okay. So the partner that is in the receiving end of a narcissist or narcissistic trait, just because it's so slow and steady, it kind of starts debilitating. Okay.
Wow.
Debilitating you. So my recommendation is, if you have found yourself in those relationships, find support for yourself as well. Find therapeutic support, because your system has been slowly been debilitating.
Nelsa, you want to chime in on that? That's very, very impactful. I like how you express that and compare that, because oftentimes, when it comes to dating, I hear a lot of women that will say, "Oh, I just met this guy, and he's buying me this and trying to take me
He's
here
great.
and
He's
trying to."
perfect.
He's love bombing. That's love bombing
Mm-hmm.
is what it's called. And I always tell my friends, or just whenever I'm having casual conversation, be careful, slow down, because that love bombing can get you in trouble, because that's usually how a lot of these guys operate, where they will love bomb you, and then once they kind of feel that they almost have their hooks in you, then
Mm-hmm.
that's when that love bombing starts to kind of dwindle or disappear, and then you start to see other sides and other characteristics that maybe have been suppressed, or maybe that they are trying to hide.
Yes. So what I would say is, if you have knowledge of narcissism, it's something that is being mentioned a lot. So hopefully more females, or more people, not just females, but more people start to have knowledge about it. But that's what I'm saying. Like, we need to educate ourselves on all this kind of different diagnoses, right? Because if you can see that somebody's love bombing you, and you know that that is kind of like a stage, you're going to be more careful than if you don't know. If you don't know about narcissism and those common traits, then you're going to love it. You're going
Right.
to enjoy it because it's wonderful.
Yeah, I feel like you're in a fairy tale, but when you come out
It,
of the clouds, you get to a nightmare.
yes. So, but if you're already aware, if you already have that knowledge, and you meet this person who's love bombing you, now you can call it what it is, and you can be like, oh, this is not normal. This is not okay. Right.
Mhm.
And then if you're more aware, when the change happens, then you're like, oh, okay, now we're in stage 2, and you can have more awareness of it.
Absolutely. For me, just personally, I've experienced quite a bit of grief in the last couple of weeks, and friends who have experienced it as well. How how can you really support a partner, particularly, I think, at the beginning stages of a relationship, as well as later on? But I think if you just met someone and things were going well, but then tragedy strikes people, um, but you don't necessarily know someone as well as maybe you would if you'd been together 20 years, let's say. What are some of the best ways to be supportive, to be there for someone, to offer support during grief? And what do you think someone who is grieving should do? Especially, I can remember I was still married at the time when my dad died, and I was just in a numb place. I was in a really foggy, lost place. And so I didn't really know what to ask for. I didn't know what to do. I was really just wandering out there. You know what I'm saying?
Yes.
So I guess those two things. How can I help someone, especially in the beginning of a relationship? But then how do I, as a grieving person, know what to ask for? What sort of things should I ask for from my partners or friends?
So I think the best way, first of all, I'm sorry to hear about your dad. The best thing that you can do for somebody who's going through a difficult time is just be there. Just listen. Don't try to fix the problem. Just listen. Listen to what they're saying. And even if they don't want to say anything, being there it's the best thing that you can do.
So basically just showing your loyalty and support, so to speak.
Your support, yes. So if the person wants to cry, if the person wants to scream, if the person wants to curse, be there without judgment, without expectations, and just offer that support. I'm here. And without offering advice. I don't know.
Let's get over it. It'll be all right in a little while. Let
None
the
of
Lord
that.
deal with it. And not to make fun of anybody who's trying to help, but oftentimes cliches only make the person shut down.
Yes.
In my own personal experience, anyway.
No, I totally agree with you. I don't know where this, my condolences, but to me, I don't ever want to hear that. But just being there for that person, to hold a hand, to be a shoulder to cry, or sometimes to give space. Sometimes somebody doesn't want company, and that's okay. Just come back and let them know when you're ready for company, I'm here for you.
Nice. I like that. So basically, bottom line is showing that you care and showing that you are there for them. And some of them might take you up on that. And some of them might be like, hey, you know what? Right now is not a good time. But, when I get through this, or when I get better, or when I'm done coping with, this emotional distress, then we'll get together, or we'll do, or whatnot. We'll get together or whatnot.
But without the expectation of somebody having to say all that. Because if I am grieving, I don't have the mind to say later on I'll be in a better time. I probably won't say that. Probably what I say is I just want to be alone.
Right.
Don't take it personal. It is not about you. It's about the grieving that the person is going through. And right now what they need is space. Is to be alone with their feelings, right? Now, if you are lucky to have somebody that can verbalize, I right now I don't need company, when I'm in a better place, then good. But if you're not, and somebody just says, I just want to be left alone, they just want to be left alone. They're going through a hard time.
Right. And everybody does process differently. Just like love languages, grief has many languages as well, I think. So thank you for just some practical advice.
Yeah. One thing I do want to say about grief,
Mm-hmm.
that not a lot of people know, is if somebody's working on themselves and grief kicks in, like something unexpected happens, the people have the tendency to digress.
Mm-hmm.
Okay. And if we don't know that as a partner, it could be very frustrating to see so much improvement go to waste. Okay.
Wow. That's a good point.
Everybody, please be mindful that if your partner is going through something grief, especially if it's something unexpected, and they digress, is part of the process.
So it's normal and natural, basically, you're saying?
Yes, it's very normal for if the person, let's say you're in a couple and you've been going to couples counseling and there has been really good progression, or even individual counseling, and they're doing really good, and then something happens and they're dealing with grief. Digression is part of this of the process.
Luz, let me ask you something. So let's say, I don't know, let's say I meet a woman, and it's early on, maybe it's only been a few dates, and we really enjoyed our company and we want to spend more time together, and then tragedy happens, and then obviously this version that I'm gonna see of her is completely different from maybe the version that I had seen the first few dates.
Mm-hmm.
What would be some techniques or some advice that you would share for somebody who is maybe on the other side, right? Like, hey, I want to get to know this person, and I don't want to just walk away from them, but I also understand that, hey, right now is not good timing, and right now is not a good time to try to be like, hey, want to go out and get drinks and go ice skating or whatever, because they're not in the right frame to be thinking or wanting any of that. So what would be a good way to maneuver to something like that?
Be a good friend,
Mm,
or be a friend.
okay.
If that person is not ready because of X or Y reason for a relationship and you still want that person around, they might be ready in 6 months. They might be ready in 3 months, 6 months, 1 year, you know? But if you're really interested in that person, just be patient and understanding.
Mm, I
If
like
that's something that you want, if it's something like, no, I'm ready to be in a relationship right now, then this is not the person, because right now this person is not ready to give that energy, because a relationship takes a lot of energy. And if you're going through grieving, if you're going through something unexpected, energy has just shifted.
All right. Focus and everything.
Exactly. So that person might not be able to give it to you right now, maybe in 3 months, maybe in 6 months. You need to determine whether you're able to wait and able to be supported.
mm, I like how you frame that. That's pretty solid.
Very cool.
Very good.
I love it.
Another thing that we wanted to kind of touch on that created a buzz here when we rolled out the pre-discussion of this show is, how does family trauma affect an individual as it relates to their own romantic relationships? Like the trickle down effect, of course.
Yes, very, very, very deeply. So we are creatures of habits, and we are creatures of, we do what we know, right?
Mm-hmm.
So if we are in a family dynamic that is dysfunctional, as we grow, if we don't have other role models, or if we don't know anything else but dysfunction in our family, we're going to go, I don't want to say search, but that's what we're comfortable with.
Mm-hmm.
Gotcha.
Even
So
create those circumstances, right? If need be.
exactly. Yes, because you don't know better. You don't know what functional relationship looks like. So the only way that you're going to find out is if you have somebody showing you, or if you yourself research. If you yourself want to change those patterns, it's going to be hard, because now you have to make an effort. Now you have to make a conscious effort of, what I know does not work. So I need to do something different right now. And we all know how hard it is to change.
Mm.
But if we make that decision, like, oh, we're gonna change, we're gonna work, we're gonna get therapy, we're gonna get support, um, it can happen. But you need to be aware of it first. Because, like I said, we do what we know.
Yeah, that's so true. And family traditions are among some of the deepest ingrained because, you're in those traditions in vitro, right?
Generational trauma.
Yeah.
Yep.
I mean, your mom passed
Generational.
it through the birth cord and all that.
Mhm.
But, I've never said this on a show before, Luz, but I think knowing your ACEs score, that
Yes.
first childhood experience score, and getting into therapy when you see that you've got one or more markers for it, especially depending on what the one is, if it's a pretty devastating one. I'm just like, we really could save ourselves all a lot of wasted time and search effort by making sure we've done our own personal inventory. And I know, having gone to therapy myself, how helpful that was in just seeing my own patterns and
Mhm.
how I was seeking people out who fit a certain mode of, what I've seen in my family, what I've experienced, in my past relationships, and how often we repeat those things unknowingly. Like, some
Yes.
stuff is so subconscious, and we're reacting as opposed to being proactive and really responding with the right from the right place. Like you said, with those knots, what came to my
Mhm.
mind? Like a little gold link
Mhm.
necklace, the really teeny tiny links, or silver or whatever. But when you get a necklace knotted, it is like one of the absolute worst things to. I've thrown jewelry away because I could not. And that's all I can think about with this, and wondering why we don't match well with people we match with after a while. It's like a 3 or 4 month honeymoon phase, and then you start really getting to reveal yourselves, and then it's almost like Jorge says, you're like, who is this person? I met this one, but then this terrible thing happened, or now they've been, they're lighting up those knots with
Mhm.
whatever they're experiencing in the relationship now, and you meet, like, you know, Dr. Frankenstein's monster. It's just like, what in the world happened? I just fell down a rabbit hole and I don't know where I am. But like, just how simple you've put these things tonight. I think hopefully will help a lot of our listeners decide for themselves, number one, because it's not always the other person.
No.
I've had to really look at myself and take accountability for the hurt places and the unhealed places that caused me to be in certain relationships, first of all, that weren't necessarily good for me. But, really looking at yourself before dating and deciding, have I healed from these things before I go walking into somebody else's life? And I think that's really probably the most important question you could ask yourself tonight, for those of you who may be out there, wondering about whether I'm ready to get back in it or not. And are you willing to do the work? Because it's not easy untangling those knots. I always need to get like a little straight pin and try to, like I'm crocheting or something, trying to get through those knots. But, that takes a lot of work.
So I do want to put something out here, since this is such a very delicate conversation. Mental health is a very serious matter, and it's definitely something that we all have to be mindful of with the people that we come across and the people that we care about, or our partners or partner. But also, the important thing is, there's a lot of people who maybe feel that they're not right, or they're not in a good mental space or mental health status, but they don't want to get the help. And me personally, if I run into a woman that attracts me, right, and having mental health issues isn't a deal breaker for me. But if you're not getting help, or you're not on the right track to work on that, that to me would be a big turnoff, in my opinion. Because then at that point, if you're not trying to help yourself, how am I going to help you?
Yeah, I definitely agree with that, because codependence
Yes.
is
Mhm.
not a relationship that you need to shackle yourself with.
And
Um,
I've dated women with mental health issues, but they have a process in place. They have medication. They do things that strengthens their mental health status. They go to therapy. They do different things to keep everything strong and sturdy. But I've also come across people who know that they have mental health issues or depression or whatnot, but they don't do anything to try to make the situation better or healthier.
Yeah, so you touched on what it is. If you find yourself in need of support, get it. Get professional support, because a friend is good, but a friend is not going to know what to say. Or they're going to have the best intentions, but it might not be what you need.
Right.
And the other thing is, for those people who have mental health, but they're not aware, what I would recommend is check if you're overreacting, right? If you're in a situation and you find that you're overreacting, that's a knot that's lighted up.
Interesting.
And same thing, if you're dating someone and you're new, this is the key. This is your first sign, and that person overreacts. Know that those are knots that are lighting up.
What about lack of emotion? You know, I've been with people who were not emotionally available before, and I've had friends who were. So how, there's the overreactor, and then there's the non-reactor as well. Would you consider that maybe even a sign?
Mm, can you give me an example? Because
Like,
I'm thinking so many things. So what
I know,
exactly?
right?
Yeah, give me an example, please.
There's some people who have had some sort of traumatic experience or whatever, but they act like I'm fine, everything's fine, I'm okay. I've even done that. Like, you're just gonna push through and act like nothing happened. You don't talk about it to anybody. You don't express your feelings toward it. You don't communicate around it. You just like it never happened for a lot of people. And then, of course, there's the eventual explosion.
Mm-hmm.
But in
So
my
that's the
mind,
knot. That's
yeah,
the
you know
knot
what I'm saying?
that's exploding.
Yeah. But they
Yeah.
don't say anything for a while before the explosion occurs. So, you know, something can't be right, because most people would not take, whatever suffering or issue or what have you,
Mm-hmm.
um, and not feel something. But the person who says that, or who shows up like they're unaffected, to me, I get a little trouble. That troubles me a
Mm-hmm.
little bit, because I'm like, oh yeah, the shoe is gonna drop eventually, and what's it gonna
Mm-hmm.
be, when it does?
So that's a defense mechanism, right? And defense mechanisms are there to help you. The problem is that we overuse them, and we only use like there's a range of defense mechanisms, right?
Mm-hmm.
And sometimes we only work with one defense mechanism, right? So in this one, it would be it sounds like avoidance, right? I don't want to talk about it. It didn't happen. If I don't think about it, I don't feel it, and therefore I can move on with my life, right? That's okay sometimes, but all the times it will eventually get toxic. It will eventually crumble down, and that's when you have your explosion.
Wow.
Okay. But hold on. So this is why I had to think about it, because then there are those people who they process things but not verbally, right? So let's say they go to the gym and they take all those feelings and they process it in the gym. So that's a different situation,
Right.
right? It's not I'm going to avoid it. It's more, okay, I'm going to concentrate it only for those 2 hours that I'm going to work through it while I'm at the gym.
Totally different.
Totally different situations, but it can manifest the same way, which is they're not talking to you about it. I would say though that the person that does go to the gym and like kind of works it at the gym, the day will be different for that person versus the one that's bottling it all up.
Right.
Okay? So eventually, if you don't have good coping mechanisms, it will catch up to you.
I really like how you laid everything out and explained it in pretty simple terms. I mean, I definitely feel smarter after talking to you about this stuff. So I greatly appreciate you joining us. Do you have a website, or do you have a company name or something that you would like to share, so that we can, share this with our listeners, because we may have some people who might be interested in your services.
I am on headway.co. So if you go to headway.co, not com, co, C-O, You can look for me, like you said, my name is Luz Velez, so you can definitely look for me there, and you can even set up an appointment there, or you can call me at, can I give my number?
Yeah, your work number, absolutely.
Okay, 980-222-1402.
And headway.co is
Yes.
how to contact you.
Yes. So you go there and you say find a therapist, and you can put my name and you can set an appointment there.
Awesome. Great, rich conversation. Thank you so much for joining us. Nelsa, you got anything else to add?
No, this was fabulous. Thank you so much. Thank you to our listeners for your input on the show tonight. Hopefully this will help whoever is out there in need. We appreciate you so much.
And we will
Thank
definitely
you
have
for
to have a
having me.
part two. We'll definitely have to have a part two at some point, because I'm sure this is something that's got a lot of branches that we can touch when it comes to mental health and all that good stuff.
Yeah.
Sounds good.
Thank you, ladies. Have a great night. And thank you for joining us at the Relationship Cycle with Jorge and Nelsa. Buenas noches.